Welcome to the Medicare for the Lazy Man podcast, the Medicare podcast for Medicare podcasters. Hi, on Dramamine Medicare expert Doug Jones.
Hello, everybody. Welcome to another exciting episode of the Medicare for the Lazy Man podcast. My Canadian nephew, Drew McMillan, may have told you that I am your Medicare expert for today. My name is Doug Jones, and I'll be helping you through the world of Medicare by virtue of the book that I write every year. Now, this one is the 2024 edition. So what you'd be looking for if you were going to go get a book to read about Medicare would be Medicare for the Lazy Man 2024. I would suggest going to barnesandnoble.com or amazon.com, putting Medicare for the Lazy Man 2024 into the search window, and voila, you're going to have your choice. You'll be able to get a paperback version, an Audible version that you can listen to, a Kindle version that you can immediately download for a very, very small price, very reasonable price. You can immediately download that to your reader if you have one that Amazon serves. And then, of course, we always have in reserve the massively priced but massively appreciated hardcover version of Medicare for the Lazy Man 2024. It is a keepsake worthy of putting on the shelf and sharing with future generations. It will never deteriorate, at least not in my lifetime or yours. And it is what you might call an heirloom. So in any event, Medicare for the Lazy Man 2024 will guide you into, through, and out of Medicare. If you sit down with a stiff drink and spend a little time reading it, you will become a Medicare expert, very much like I am. So please consider, if you're thinking about Medicare, purchasing Medicare for the Lazy Man 2024. And now I have, it's my pleasure to introduce my partner in crime, Randy Carson, who is trying out new software. And apparently the new and advanced improved software thinks that he would be better off in a fuzzy state. And so while his background is sharply in focus, his face looks like it's almost like a cream pie somebody might have smashed into your face. Randy, it's
I think I think the new software decided that, when I said touch up my appearance, it just wiped me out. That's what it did. Yeah.
So your AI is not working to your advantage today. You've got to be more specific.
No, it's not working at all. But I think everything else is working okay. But so how are you out there in the lowlands of Illinois?
Well, yesterday it was in the 80s and humid. I think it was 90 degrees and humid. I had to go to a doctor's appointment at 3 o'clock in the afternoon. I remember looking at the thermometer in the car, and it said it was 90 degrees. It was humid. It was partly sunny. Today, the sun is not out, and my computer says that it's 69 degrees out there. So apparently we've had an abrupt change in the weather. So that's
69. Holy cannolis. That's pretty cold.
I know. And I'm wearing my shorts. I'm thinking if I had to go outside, it would be uncomfortable. Well, maybe not at 69, but in Arizona, that would be pretty chilly. What's your weather? What's your weather like today? Sunny?
Oh, it's a nice.
That was my little joke.
Yeah. It's a nice spring day. We're at 100 right now, moving on up to 107 right after lunch.
All righty. Well, I don't have a reason to complain either way. I mean, frankly, 107 is a lot. It's like 10 degrees lower than many of the record hot days that you might have in the summer, so it could be worse.
And, by a long shot.
Illinois at 69 degrees isn't that horrible, so I'm not going to whine and complain about that. There's plenty of other stuff to whine and complain about, and I think we ought to get to it. What do you think?
I think we ought to get to the whining and complaining part too.
Well, our first step in that direction has always been the Medicare Advantage Minute. And that's a little thing I invented so that we didn't spend all of every episode whining and complaining about Medicare Advantage plans. We do want to spend some time every episode warning people away from these dangerous, potentially disappointing health insurance plans that people can get when they approach Medicare. And many people don't realize the negative consequences of a Medicare Advantage plan. So what I've done is I've made a list of articles that I've collected, and I sent that list to Randy, I thought. Now, it may be that I failed to do that. So I've got a numerical list of the articles that I've got saved up to deal with, one per episode for a Medicare Advantage Minute segment. I forgot to send Randy the list, probably, so he's got to pick a random number between 1 and 20.
I am going to go for 9.
Okay. First thing I'm going to do is mark off number 9 so that we don't accidentally read that one again sometime. And then I'm going to go through the stack and remove article number 9 and tell everybody, who I'm sure is waiting on pins and needles, I'm going to tell everybody what it's all about. So here we are, the first article in our new batch of Medicare Advantage Minute articles. This article is entitled Medicare Advantage Cuts Coming This Year, Retirement Specialist Warns. So this is a fairly recent article from June of 2024, and a retirement specialist is warning that Medicare Advantage cuts are coming our way. So, a retirement specialist is warning seniors to prepare now, as Medicare Advantage cuts are likely to come during the next year. Bob Carlson, an attorney and accountant who runs Retirement Watch, which is a monthly newsletter and a website on retirement planning. He wrote an article for Forbes that Medicare Advantage plans will be cut as the federal government looks to reduce its spending. Medicare Advantage plans have become increasingly popular. I disagree with that. More than half of the current Medicare participants are enrolled in a Medicare Advantage plan in 2024. They often have lower out-of-pocket costs for payment while you're carrying the plan. They have higher out-of-pocket costs when one gets sick and needs to use the plan in most cases. Now, that is me talking. The article is not being entirely forthcoming with all of the facts. So then they're saying that seniors are being offered more flexibility with vision and dental coverage options in the Medicare Advantage plans. Still, when seniors evaluate their plans during this year's open enrollment period, they may find that upcoming changes to Medicare Advantage will make their current plan less attractive. This guy Carlson wrote, changes are underway. Those enrolled in Advantage plans or considering them need to pay careful attention when evaluating plans in this fall's open enrollment session. There could be significant modifications to existing Medicare Advantage plans. He said that Medicare Advantage plans tend to be popular because they generally have lower premium costs if you are healthy and can bundle supplementary insurance and drug coverage options. They also tend to be more profitable with insurers. That's why insurance companies fight to keep them and fight to keep the federal government hands out of their profitable pockets. Still, the federal government is looking to curb its costs by reducing Medicare Advantage options. Reduced payments to Medicare Advantage sponsors are likely to cause changes in the plans in 2025, such as higher premiums, higher co-payments, and higher deductibles, as well as reduced coverage. The CMS, the Centers for Medicare and Medicaid Services, lowered its Medicare spending 2 years ago, and leaders at some of the big insurance companies have issued warnings about changes. One of the companies said that first quarter earnings were lower than predicted, and company leaders expect earnings to dwindle below prior estimates. Let's see. Another warning was issued earlier this year by Humana, which said that its Medicare Advantage business was not doing as well as expected. Both CVS and Humana said it would take at least a couple of years to restore profit margins in their Medicare Advantage plans. The reduction in Medicare Advantage was also confirmed by Medicare, with officials saying that plan reimbursements would be lower than what the insurers expect for 2025, as Medicare and all plans in its ecosystem. What the hell kind of an insurance term is that? Anyway, as these plans continue to absorb more of the federal government's yearly budget, policymakers have looked for areas where they can cut back. One of the easiest is Medicare Advantage. The result is in coming years, Medicare Advantage providers will see fewer payments to reimburse costs for those enrolled in their programs, and customers will be left having to pick up more of their bills for items and services that were originally covered. The cuts could span several areas, with Medicare saying that blood tests to detect early signs of an organ transplant failure would no longer be covered. That type of switch means that patients will need to wait until they display enough symptoms to get a biopsy. Other cuts are also likely. The news arrives as Medicare Advantage plans are using services beyond what the insurers prepared for. For CVS, that meant higher outpatient service use and inpatient hospital admissions in the first quarter. As a result of the upcoming changes, this newsletter guy urged Medicare Advantage members to consider their options during open enrollment this fall and to take note of which changes would impact their health care. They also might need to add on a backup plan like Original Medicare and a Medicare supplement. Well, you can do that if you're healthy, and you can fill out a Medicare supplement health questionnaire. Otherwise, if you've been in a Medicare Advantage plan for over a year, you won't have that option. This is another reason I warn people to stay away from Medicare Advantage plans. You can always switch from Medicare supplement to a Medicare Advantage plan. You cannot always switch from a Medicare Advantage plan to a Medicare supplement. So it's better to be safe than sorry and go with Medicare supplement from the outset. It's a lose-lose for Medicare Advantage providers and for recipients. To providers, they now will be unable to cover every expense they once could or promised to those who enrolled through them. For recipients, they're now left with picking up more of a tab for their medical expenses. A guy named Chris Fong of Smile Insurance Group says he expects the cuts to cause a lot of retirees to look around and to make a change. He said the retirees most affected will be those with lower incomes or those who are physically limited in some way. The areas of cuts will vary by insurance company and even down to the individual plans. We are either expecting higher copays or lower extra benefits, which include health, foods, grocery, dental, vision, hearing, transportation, and any other non-Medicare covered benefits. Okay, well, I believe that that's going to be something that we're going to hear time and time again. There are going to be big changes coming down the pike, and Medicare Advantage plans are going to hit some turmoil this year in preparation for the 2025 policy year. Okay, Randy tells me that we're halfway through this episode already. I'm shocked to hear that. So I think the time has come for us to take a little commercial break and let the sponsors take over. And then I'll be asking you whether what they had to say was more interesting than listening to a Medicare Advantage article. Okay, we're back. I hope you enjoyed that little commercial break. I'd like to think that our sponsors are more entertaining than other sponsors of other shows. I just don't know that that's a fact. But in any event, now we have come to the point in the episode where I join Wikipedia for just a short period of time to continue on with the very massive Medicare page on Wikipedia. I listen to a podcast regularly called Wiki Listen, and that podcast is really a compilation of Wikipedia pages. They read one page every episode, and it's a fairly short episodic series. The episodes run from 5 minutes to like 20 minutes maximum, and they pick out a page that these boneheads that read the Wikipedia pages think is going to be interesting. So I thought, well, why don't I join the boneheads? I'll do my own Wikipedia or Wiki Listen podcast. And therefore, I have been working on the very lengthy Medicare page from Wikipedia. We're up to a section in the page that talks about penalties on hospitals. It says the highest penalties on hospitals are charged after knee or hip replacement, $265,000 per excess readmission. So they're talking about the fact that if the processes that the hospitals and doctors use aren't properly applied to the patient care, in other words, if the patients have to come back to the hospital after having been admitted and operated on and discharged, then the government kind of penalizes the hospitals because they assume that the patient should have been treated in a more effective manner. So this goes on to say the highest penalties on hospitals are charged after knee or hip replacements, $265,000 per excess readmission. The goals are to encourage better post-hospital care and more referrals to hospice and end-of-life care in lieu of treatment. While the effect is also to reduce coverage in hospitals that treat poor and frail patients, the total penalties above average readmission in 2013 are $280 million for 7,000 excess readmissions, or $40,000 for each readmission above the U.S. average rate. Part A fully covers brief stays for rehabilitation or convalescence in a skilled nursing facility in up to 100 days per medical necessity, with a copay if certain criteria are met. Number one, a preceding hospital stay must be at least 3 days as an inpatient. That means 3 midnights, not counting the discharge date. Number two, the skilled nursing facility stay must be for something diagnosed during the hospital stay or for the main cause of hospital stay. Number three, if the patient is not receiving rehabilitation but has some other ailment that requires skilled nursing wound management, then the nursing home stay would be covered. The care, number four, the care being rendered by the nursing home must be skilled. Medicare Part A does not pay for stays that only provide custodial, non-skilled, or long-term care activities, including activities of daily living, such as personal hygiene, cooking, cleaning, etc. Number five, the care must be medically necessary and progress against some set plan must be made on some schedule determined by a doctor. The first 20 days would be paid in full by Medicare, with the remaining 80 days requiring a copayment of $204 per day as of this year. Many insurance group, retiree, Medigap, and Part C insurance plans have a provision for additional coverage of skilled nursing care in the indemnity insurance policies they sell or health plans they sponsor. If a beneficiary uses some portion of their Part A benefit and then goes at least 60 days without receiving facility-based skilled services, the 90-day hospital clock and the 100-day nursing home clock are reset, and the person qualifies for new benefit periods. Hospice benefits are also provided under Part A of Medicare for terminally ill persons with less than 6 months to live, as determined by the patient's physician. The terminally ill person must sign a statement that the hospice care has been chosen over other Medicare-covered benefits, for example, assisted living or hospital care. Treatment provided includes pharmaceutical products for symptom control and pain relief, as well as other services not otherwise covered by Medicare, such as grief counseling. Hospice is covered 100% with no copay or deductible by Medicare Part A, except that patients are responsible for a copay for outpatient drugs and respite care if needed. All righty, so that's a little more of the Medicare Wikipedia page, and I didn't want to spend too long on that because I've got other exciting factual information. Randy, what is our timer looking like? How close are we to our target time?
Well, I would say, given the fact that my timer quit working, I would say we have about 10 to 15 minutes left, but the new software timer that I use is not timing.
Wow. So technology marches on then, huh?
It does, and so does time. Time is marching on, but I'm guessing we have about at least 10 to 12 minutes left.
Okay, so this might explain why you told me that we were time for a commercial break in the first 2 minutes of the episode.
That had a lot to do with it.
All righty. Well, I just set my timer because I forgot to set it at the beginning of the episode. We're gonna look like real pros here by the time the audience gets disgusted and turns us off.
I did figure out my video problem though.
Oh yeah, you look much clearer now.
You have to get really up close here.
You look much clearer now. I bet you thought I was going to say much better, but
I was going to say that's not a good thing on your end of the world. But
fortunately, my vision isn't what it used to be, so you look great to me as far as I'm concerned. Okay, so I've got a whole bunch of smaller items that we can kill a bunch of time with, and not kill time because these are important. I've been yakking about that our current administration has given us the gift of inflation. And when you have inflation given to you by your government and by the morons that make a lot of governmental decisions, one of the first areas that gets hit is medical inflation. Now, I don't know if that's because there are too many cooks in the kitchen, or if it's because that medical procedures and so forth are more sensitive to economic conditions. But one of the results of medical inflation is that the cost of the products that I sell increases, and in an inflationary period like we're in right now, that cost increases more quickly than I have promised my clients, and more quickly than anybody would like it to. But somehow the relationship between the plans that get the largest increase and the increases for the plans that I recommend, which would be the high value plan, the high deductible plans, those relationships remain fairly constant. And so I'm going to tell you what a few companies are up to right now in their planned rate increases for their Medicare supplement plans. In Alabama, Omaha Life, which is a Mutual of Omaha subsidiary, Plan F, which is only available for older people, is going to get a 10% rate increase, while Plan G is going to get a 7.75% increase. Mutual of Omaha, the mothership of the Omaha Medicare supplement company in Ohio, they're going to give an increase of 20% to Plan F. This is why I warn people, if you've got Plan F, your rates are going to increase much more quickly than you ever expected. And that's because the influx of newer, younger, healthier people has been stopped. So if you've got a Plan F and you're in pretty good health, you should contact me, and we can switch you to a much less costly Medicare supplement plan that will still do the great job for you. So in Ohio, Mutual of Omaha is going to give a 20% increase to Plan F. Now, they're also going to give a 20% increase to Plan G. So apparently their loss ratios for Plan G have been higher than they expected to. What are they going to give for the plan that I recommend? High deductible Plan G, 0% increase. So that is something to keep in mind when you're picking out a plan. I tell people that the rates will increase more drastically and more frequently for Plan G than they will for high deductible Plan G. In Wyoming, their subsidiary there is going to get a 6.75% increase for Plan F, 16% for Plan G, and apparently nothing for high deductible Plan G. And the same kind of thing is going to happen in Georgia, their subsidiary in Georgia. Plan F, 6%, Plan G, 4%, and no increase listed for high deductible Plan G. When we go to New Mexico, we're looking at 16% for Plan F, 16% for Plan G, 0% for high deductible Plan G. Same thing in Michigan. It's going to be 12% for Plan F, 10% for Plan G, and 0% for high deductible Plan G. So if you have been smart enough to purchase a high deductible Plan G from that company in any of those states, you are less likely to see a rate increase than you would be if you had Plan G or Plan F. And then I've got a list of Medicare supplement rate filings for August of 2024 from an actuarial reporting company. And I'm looking down the list here. Aetna rate increases across the board average 12.3%. Allstate Health Solutions, 13%. American Benefit Life Insurance, 10%, 11%, 13%, 8.9%. We get down to Atlantic Capital Life Insurance. I don't know anything about that company. 1.8% increase in their Medicare supplement plans. Cigna, 6.5%. Plus, I'm a little cautious about Cigna right now because they have sold off their book of business to the company that also owns 5 different Medicare or Blue Cross Blue Shield companies. So I don't know what's going to happen with them. I'm not encouraging my clients to purchase Cigna plans. We're reading on through the list of companies that have filed rate increases during the month of August: 10%, 7%, 19%, 16%, 5%, 5.2%, 13.5%, 7%, 5.5%, 10.2%, 9%, 14%, 6.2%. Here's Primera, Blue Cross Blue Shield of Alaska. They're going down. They're reducing their premium by 28%. I thought that was interesting. And United American Insurance Company, the plan that I recommend very often to people in various states where their premiums are quite reasonable. In this case, the state of Iowa, they're looking at a 7.3% rate increase across the board. That's their average rate increase for the plans in force in Iowa. And finally, Medicare supplement rate actions for the second quarter. I've got charts here, and in every instance, the companies shown are Aetna, Blue Cross Blue Shield, Cigna, Humana, Mutual of Omaha, United Healthcare, and other companies. In every case, the 2024 rate increases, the second quarter of this year, the average rate increases have been highest, except for Cigna. Cigna had higher rate increases in 2020 and 2021. Otherwise, these companies are all having the highest of their rate increases in the most recent 5-year period. The rates are increasing more quickly now than they have been in the last 5 years for most of these companies. So something to watch out for. This is another reason why I suggest, and I think it's a good, solid suggestion, if you have reasonable health and you're coming to Medicare and you don't want to put up with the disappointments that Medicare Advantage plans are likely to provide for you or to offer you, then Medicare supplement is the only way to go and the best plan to avoid the effects of inflation is going to be your Medicare high value plan or Medicare Plan G high deductible. So that's going to be my recommendation. I have something that just came in hot off the presses right before we started recording this episode. It's from a client of mine named Bob who signed up about a year ago. And he says, Doug, it's been a long time since you helped me maneuver through the morass of Medicare. You suggested, and I took your suggestion and enrolled with United American Insurance High Deductible Plan G. I also tune in periodically to your podcast, quite entertaining and informative. Anyway, my birthday is coming up in September, and I just want to know if I should stay with United American. He said, my monthly premium is $67. I don't know what state he's in, but it's going to be lower than that in many other states. But I also don't remember how old Bob is offhand. I'll have to check that out. Anyway, he says, I ask only to see if there's a better choice that you propose. Things do change over the course of a year. He said, I'm pleased with United American as I basically have had no contact with them At this time, I am not close to meeting the $2,800 deductible, which is great, and fingers are crossed that it stays this way. What do you suggest? Well, Bob, I'm going to suggest that you stay put right where you are, because United American is still a rock solid, wonderful company. They take their Medicare, their customer service responsibilities very seriously. Their customer service staff is not recruited from foreign countries. They're very easy to communicate with. And you are living the right way if you don't have any contact with your insurance company, because that means they're doing the job that they're supposed to be doing without your input, without needing input from you. I am not going to suggest that there is a better option for you, because Medicare supplement plans are still the right way to go for everybody. Medicare supplement plans from 2 or 3 carriers are going to be the best on the marketplace, and Medicare supplement plans from United American are typically going to be aggressively priced if you buy the high deductible plan. I don't say the same thing with their Plan G or their Plan F. I think in many states those rates are a little too high, or a lot too high in some cases. But Medicare supplement plan, high deductible Plan G from United American in many places is the best rate going. And I don't see that situation changing at any time in the future. And in case Bob isn't listening, I'm going to also put this in writing so that he gets a complete answer to this. And then I was pawing through ancient files that my family has saved. What a bunch of hoarders, I'll tell you right now. You get a literate family that likes to read, and you get all kinds of things. In this case, this item is my fault, because I did the planning for a magnificent trip for old people in old Corvettes. People say, you take an old Corvette trip. Is that because the cars are old or the people are old? And my answer is yes, that is correct. And so the trip that I helped plan with my friend Roy started at the headwaters of the Mississippi River. And over 2.5 weeks, we traveled in our 1960s Corvettes all the way down to the southern tip of Louisiana, far past New Orleans, and we went to the mouth of the Mississippi River. Through part of that trip took us through Missouri, which of course was in the Louisiana Purchase, and I ran across a little thing listing about the flags, the number of nations that have held sway over the area which is the Louisiana Purchase. In this case, the town is New Madrid, Missouri, where that massive fault line is that may cause another huge earthquake. We don't know if or when that's going to happen. But the whole idea is that several nations have had the authority over that land. And so it says, what were the flags over New Madrid? And this corresponds to the Six Flags amusement parks. This is where they got their name. In this case, the flag of Spain was the first one to fly over New Madrid, Missouri. Some fur traders established the first permanent settlement in 1783, and the settlement was named after Madrid, Spain, although the hillbillies in Missouri pronounce it Madrid. In 1789, that's when it was established, and it was to be the seat of the Spanish government in the New World. If you looked at that little town now, you'd say, oh my God, what happened to their obsession with having a capital? New Madrid, Missouri is almost deserted now. It's really sad. Number 2, although Spain had secretly ceded the Louisiana Territory to France, it continued to rule until 1804, when authority was officially transferred in St. Louis. The following day, the French transferred the territory to the United States. Captain Daniel Bissell took charge of the Spanish post at New Madrid on March 18th of 1804. Number 3, the flag of the United States has flown over New Madrid since that date, with the exception of a short period during the Civil War. Number 4, Missouri achieved statehood in 1820 and was admitted to the Union in 1821. Number 5, Missouri had 2 governments and capitals during the Civil War. 1861 to 1865 was when the war occurred. The military authority of the government in exile was the Missouri State Guard. Prior to the admission of the state into the Confederacy, New Madrid was under the jurisdiction of the State Guard. That flag contained the Missouri seal embossed in gold on a solid blue field. And number 6, forces of the Confederate Army reached New Madrid in late July 1861. So it wasn't free of Union control for very long. The Confederate Army came in July of 1861, and in March of 1862, they had to evacuate as the Union took control of the New Madrid area, and it came under sway of the United States of America. So that was the 6th flag. The United States flag was the last one that they have enjoyed flying over New Madrid, Missouri. Well, I don't know how much time we've spent, but I'd like to say that it was time well spent. I hope the listeners would agree with that. And Randy, I bet you have a few comments for us.
Well, you know something? I do. I always, when you talk about New Madrid, the thing that always pops into my head is when that earthquake hit.
Yeah.
That basically hit that fault line down there. They say, and I have no reason to disbelieve, that the church bells in Philadelphia rang because of that.
Absolutely. But there were very few white men in the area. So the only stories they have were from the Indians that observed and passed down their oral history, their oral traditions. And they said that the ground just heaved up and down as though like you were in bed with a blanket and you were, holding it up in the air and allowing it to drop again. That's what the land was doing. And I guess it changed the course of the major rivers in the area.
Yeah, exactly. Well, I need to close up shop today because I know you're a busy guy. The 75 cents has run out because I can't seem to get any more funding. I don't know why that is, but I'm going to keep working on it.
Good for you.
So grab your pencil, people. You need to write down a couple things. Number 1 is the email address that you can reach out to Doug with, dbj@mlmmailbag.com. Don't forget, he is licensed nationwide to help you with your Medicare planning, Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would appreciate it if you could drop a couple reviews for us in your wanderings through the wilds of the internet. Last but certainly not least, thank you for joining us today. We always appreciate it because the numbers make it all for this. So I probably need to remind you that you have just spent about 32 and a half minutes with Doug Jones, the insurance guy from Oklahoma. No more. He's camped out in the low ground of Illinois. Now, I'm waiting for him to return, and he says he will, and I'm looking forward to that day. But right now, he's still camped out at 734 feet, is it?
32, but who's counting?
32 feet. So I'm just,
732 feet. You forgot the 700 part.
732 feet, give or take a foot. But bottom line is I can't wait for him to get it back out here and spend his time for the rest of the season in his fortress of solitude. And depending on the day, it can be as high as 15,000 feet.
Well, I'm with Randy. I like Arizona. I want to be in Arizona, and I plan to return at the earliest possible opportunity, hopefully next month. So in the meantime, I hope all of you will come back and listen to our next episode. We'll be waiting for you to arrive and waiting with the bells on, as the expression goes. So have fun in the meantime. Bye-bye.